Hey guys, it's Friday, March 9th, and I just came back from the breast surgeon. They had the results from my biopsy, and they were actually okay. The tumor in my breast is cancer. It is an aggressive cancer. They are waiting for a couple markers to determine whether or not it is a triple negative. But we're definitely going to have to take action. The good news is that there was no sign of cancer in my lymph nodes. So that means it hasn't spread. That puts it at a stage 2, though. So again, we have to move forward with treatment. He is Dr. Contino here in Saginaw. He goes to a conference every Wednesday, and he's going to take my case to the conference just so they can review it. I have an appointment next Wednesday with an oncologist here who does nothing but breast cancer. Well, 98% of his patients are just breast cancer patients. So I feel good about that. So that's that'll probably be every Wednesday. I had already opted because I have not the BRCA2 but the BRCA1 gene. The BRCA1 gene mutation, what that is the BRCA, or that gene itself, is the fighting gene. It's the one that fights those cancers and things like that. Well, my fighter's broken because I have that bad gene. So it's just waiting for cancer to show up. Cancer grows. It can't fight it. So I've opted for we're not just going to treat one breast. We're going to have a double mastectomy. I'm not, when I first found out, when I had the gene testing, I was told that if I had the full hysterectomy with the oophorectomy, that it would reduce those odds. But it didn't. Actually, 25 years ago this month, my mother was first diagnosed with cancer. Actually, she had her first lumpectomy April 1st of 1993. And not until several years and a couple other lumpectomies did she see a genetic counselor to find out that she did have the BRCA mutation, which led me to be tested. So you think about 1993 when she had her first lumpectomy until they told me to get tested when she found out in 2006. So I had a little more opportunity to get to fight. And, looking back, I probably should have had the double mastectomy back then. But here's, sharing this knowledge. Maybe I'll help somebody else with the BRCA gene and let them know, yeah, the double mastectomy would be your choice for survival or for not getting or having to deal with lumps and things like that. Because if there's no tissue for it to grow in, yes, you can go other parts of your body, but, so that's one of the reasons why I'm sharing is I want to make sure that the information, my experience, my history, I'm still scared. Yeah. Trying to keep my head up. Trying to look on the bright side of things. Looks like I'll be doing chemotherapy, and again, probably do that. We haven't set the schedule in stone, but it looks like it's a 3-week chemotherapy, rest for a month, and then do the mastectomy and then reconstructive surgery. So I'm trying to look at the silver lining. I just had a bunch of weight loss and things are starting to sag everywhere. So new tatas. I'm going to get new tatas. New tatas, and maybe if I lose some of it, it'll come in thicker. It's a fight, and I'm trying to find the good things in it. So, yeah, it looks like my My summer's going to be a little busy. My spring's going to be a little busy. But he said it's totally doable. So I trust him. I know I got a fight in me. You know, I get it from my mom. I mean, she had a fight in her. And if she hadn't had that genetic testing, I could very well be not paying attention to my body. So for those of you who have not been identified as a BRCA, deficiency or mutation, don't stop keeping an eye on yourself. You notice anything that looks funky, feels funky, check it out. Don't wait. If I had waited, it could have made it to my lymph nodes. And then it would have been stage 4. And then I would have been doing the real fight. So I'm grateful that it didn't, And that's why I'm like, let's do this. Let's start it. Let's go. Let's not give it an opportunity to get any farther. Kind of like, got a grandson on the way. I got a daughter graduating college. I don't want to miss any of this. So, I'll keep you in touch, or I'll keep you up to date. And my next video will probably be after I speak to the oncologist next Wednesday on the 14th. So have a good one. I'm going to rest a little easier this weekend. Maybe get a little more sleep. And until then, take care, everybody. Bye.